Hi, this is Carol Winchester, President and founder of Dysphagia Management Systems, coming to you from my kitchen in my home here in Sarasota, Florida. You may have seen an earlier post where we talked about the fact that we were going to go live on April 1st with DMS at home teletherapy. Well, we've pushed the button and we are now live. We are speech pathology specialists who work with dysphagia or trouble swallowing. The reason we're doing this now is because so many of us are stuck at home. We're going to be here for the foreseeable future. And what we don't want to happen is for people to suffer needlessly because they're not getting the dysphagia therapy that they need, or they don't understand how to operationalize this within their own setting. We're experts in dysphagia management. We're speech language pathologists who perform endoscopy or fiber optic endoscopic evaluation of swallowing and create dysphagia management plans for our patients. Now, because of this program, DMS at home teletherapy, we're able to provide a diagnostic, a consultation, your therapy. We're even initiating groups. We're initiating support groups. So for example, if you have a support group for post-thyroid cancer or Parkinson's or stroke or whatever, and you've lost your ability to gather, we have the place. We have a HIPAA compliant place and the professionals to help you put these groups together and be able to support each other through this situation. There are 5 things that have to happen when you swallow. First of all, the respiratory system, which happens to be affected severely with those who get COVID-19. But you have to be able to hold your breath 1 or 2 seconds in order to swallow. If that becomes impaired, your swallow can become dysfunctional. Muscularly, you have to be able to chew and swallow. Neurologically, you have to be able to feel that there's something in your throat that needs to be swallowed. And gastrointestinally, swallowing should be unidirectional and going into your stomach, but if it comes back up now mixed with acid and it drops into your airway, it can affect an already compromised respiratory system even more. And finally, the cognitive system, not only understanding what is safe to eat or drink, but also the fact that swallowing comes from the central command of the brain. And it tells you, is it sweet or sour, or how much do you need to chew, or how much does the esophagus need to open? All of these decisions are being made in a split second. So what we do as experts is we break this apart. We figure out which systems are working and which aren't. And then we try to put it back together in a way that you can manage this safely in the comfort of your own home. That's the key. The key is operationalizing it according to the foods that you like and who's making your foods and where you're getting, what is available to you, and what position do you want to eat? Do you eat sitting at a table, in a chair, or in bed? We operationalize this exactly for you. We understand that in light of this COVID-19 emergency, that we're all in a situation we've never been in before. And what our goal is, what our mission is to be able to reduce dysphagia-related repeat hospitalizations, infections associated with the complications, weight loss, coughing, choking, lethargy, because you have little bits of aspirated items going into your lungs and making you tired, or even failure to thrive. These are things that we feel confident we can work with you on so that you can thrive within your own setting. Because improving your comfort, care, and quality of life is what we here at Dysphagia Management are all about. So how did we do this? How do you get a hold of us? It's very easy. Initiating a conversation with a DMS speech pathologist is as easy as calling 833-DYSPHAGIA. That's 833-397-7424, or go online at 44dms.com. Again, that's www.44dms.com. Once you get on our website, you will see that we have a button that says to initiate contact. Press that button, click on that button, and you'll fill out your information. One of our intake specialists will get back to you, but in the meantime, you will be sent an intake form. Now, here's the deal. Because we're customizing this just for you, you need to tell us what you need. Did you already get therapy, but it didn't get completed? Do you need to be newly diagnosed? Has your condition changed? Do you just need some support, need some other people to talk to? Do you not understand how to thicken your liquids? Do you need to be part of a cooking show where we show you how to make something that you like in a consistency that is safe? This is what's called customized DMS at-home teletherapy. So on this intake form, you'll share with us what's going on and you tell us what you need. We will get you to the right person. Because of this emergency as well, we realize that we're all in a tight spot. And we do not want anyone to not get what they need because of cost. So we are reducing our prices 80%. And that means depending on your insurance type, it could cost you between $0 and the price of your specialty copay. We also will make arrangements for those who are having a hard time right now so that you can delay payment or spread it over time. Bottom line, less than the cost of a dinner, you're going to be able to get the help that you need. So what are we here for? We are determined to help those that would benefit from the help that they need right now while they're isolated at home. And we have the expertise to do it. We are speech language pathologists who specialize in dysphagia management, who specialize in individualizing programs for folks such as yourself. So if you are someone who works with patients, you are a patient, you are the spouse of a patient, you're somebody who runs a support group, you are at an association that works with groups of patients, I know there's a way we can help you. Again, we are DMS at home teletherapy 833 dysphagia. We want you to stay safe with DMS at home teletherapy. We're here for you. Thank you.